So Harvest Health, it has several parts to it. Harvest, that comes out of the biblical principle of reaping and sowing. And so essentially, a lot, especially today, in today's age, people want things, but they have not necessarily worked for them or put in the time for them or given their all to get those things. And I think that comes with health too. It's just a slightly different approach at looking at health. You know, you come to the doctor, you have high blood pressure, you have diabetes, and yes, there's a pill for that. But let's also talk about lifestyle and the things that you're doing that are making your disease process worse, and also behaviors that we can implement that can help move you in the right direction outside of just taking the medications. And so medications are important because if you have disease, you know, you want it to be treated, but at the same time, we want to find out the source. In terms of health, it's not just medicine, it's health because health is holistic. It's not just about taking a pill. It's about, you know, what are you doing emotionally? What about mentally? You know, financially even? Do you have the resources that you need? In medicine, there's a term called social determinants of health, and that is the things that determine your health that are outside of medicine. So when it comes to where you live, if you have access to healthy foods, what kind of job do you do, essential workers, you know, what kind of exposures do you have, especially in the risk of, or in the age of COVID. And so you have to look at all these things because all these things create the picture of a person's health and they're all intertwined. And so you can't just look at one and treat one and not have any examination of the other impacts and how it affects a person's health. An MD because I'm a medical doctor.